This is a slide on the key parameters for planning a hospital. So these are some of the considerations that you were speaking to before. Is there anything you'd like to add to what you spoke about previously around those parameters?
Yeah, I think we mentioned these things before. So we think about the first part is about all the services that are be provided, the beds that are needed, and there are standards, right? So if you need a medical bed, like a patient, a bed for an inpatient medical patient or inpatient surgical patient, there are standards of how many. I think they still use square feet, how many square feet you get, and what's part of that room. Is it now? It's all the rooms are planned as single rooms with bathrooms, is that kind of thing. But it's again, you don't get to go in and decide how you're going to make your own patient rooms. You can design how they look maybe, but it's the square feet that's important at this stage. The financial we talked about, where you get a budget from the ministry, but you also have to raise a local share to pay for that. And the local shares are quite extensive. The other part, we talked about this a bit, the strategy, but you have to align with where the government wants to take the healthcare system, right? It's their prerogative to set health system strategy. We vote for them and we implicitly endorse their direction. But right now, the big focus is on partnerships. So making sure hospitals are working together so that they're not duplicating services where they don't need to. And also hospitals are working with providers both in the sort of pre-hospital phase and the post-hospital phase to make sure people are getting the care they need in an efficient way. And a lot of planning now, that strategy is saying hospitals don't need to grow as fast as population growth and aging, but other community services, so long-term support services provided in the community need to grow quite quickly so that we can keep people at home longer and get them out of hospital sooner. And we can't submit a plan that isn't consistent with that vision.
So when we talk about in needing the community and primary care supports, that's mandated by the ministry. That's something that the proposal that we submit has to align with that vision.
That's right. That's right. I mean, they're the government, for example, is actively increasing funding to home care, right? For the same reasons, to keep people at home where they want to be, keep them healthy, keep them out of hospital. The government is funding the construction of a lot of new long-term care beds with the objective of getting people out of hospital who need to be in long-term care faster, not having people on that ALC status, which we talked about before. This is the idea of people who are in an acute care hospital. So they're in somewhere that's meant to be providing short-term intensive care, but they no longer need that level of care, but there's no space for them in a long-term care home to leave. So they end up languishing there, not getting the programs and services and the right, comfort that they need, but also taking a resource that someone is waiting in the emergency department to get into that bed. So the ministry is working to improve all that flow.